On this episode, we're going to talk about COVID-19 and other viruses and what happens when they enter the body. We have a pediatric infectious disease specialist, Dr. Ralph Watchi, and he is also going to help us talk to our children about the pandemic. Hi, welcome to Health Journeys, a podcast about real human experiences in health and medicine. I am your host and healthcare advocate, Maritza Hasty. Health Journeys is all about discussing the diagnosis and treatments of diseases and exploring personal stories in pursuit of overall health and well-being from different points of view. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Today, my guest is Dr. Ralph Watchi. He is a pediatric infectious disease specialist here in Los Angeles. Hi, Dr. Watchi. Thank you for joining me today.
Thank you for inviting me.
Absolutely. We really appreciate having you. And we wanted to get to know you a little bit better. And I also want my listeners to get to know you a little bit better. So can you tell us a little bit about your education and how it is that you came to select infectious disease, especially in pediatrics, as your area of expertise?
So I am originally from Lebanon, and during the civil war in 75, 76, I went to Brussels, Belgium, where I got a medical degree, and it was not possible to study during the civil war in Lebanon. And then over there, I was impressed by one of our teachers who was specialized in fever of unknown origin. That was a fascinating topic. And I decided that I would subspecialize in infectious disease. And in pediatrics, I like pediatrics because it's a field where you have to deal with a child who doesn't talk, who doesn't express well what's going on with him. So there is a lot of guessing game and trying to guess and succeed in our diagnosis, making it the right diagnosis. And then I went to New York. I did my training in pediatrics, and I came to Los Angeles to do my subspecialty in infectious disease, and at UCLA. And then I went to USC. I was clinical instructor for 4 years. And when I got married, I went into private practice because academia was not. My salary in academia was not enough to have a family. So, and now I'm practicing in Los Angeles, in West Hollywood, and I'm seeing all kind of patients. I'm seeing only children. I'm learning every day.
Wow, that's an interesting story, especially starting with the fact that you went through the civil war in Lebanon and then the various countries that you studied in, and then how you come to Los Angeles. Thank you so much for sharing that and for giving us a glimpse of your background. So basically, you were saying that with pediatrics, it's interesting because they don't express themselves and it's hard,
Exactly.
it's difficult. So when you have a patient who comes to see you, how do you explain to a child that is able to talk, they're a little bit older, how do you explain to them what it is that you do?
So, usually I get the story of the illness of the child. I get it from the mom, so it's a second-hand account. And so basically what I do, I try to calm down the child, because every time I have to examine a child, there is a little bit of fear and anxiety. A lot of them cry. So I have to smile at them and get them a lollipop. And some kids, they ask me, can I use your stethoscope? Can I listen to the heartbeat? And I help them. I have them listen to the heartbeat, and little by little, we get used, but we learn to be patient with children. But for the most part, they are difficult. I mean, up to 5 years. After 5 years, we can reason them a little bit, but the first 5 years are
Right.
difficult. Yeah.
Yeah, so a lot of it is more the interaction with the parent and especially the mom and
Yes.
getting everybody to calm down and so with that in mind, can you tell us a little bit about what it's like, as a mother? I am a mother of three, and
Mm-hmm.
my youngest, at one point in time, I was scared to death because I was told that there was a possibility he had a brain tumor. So, you
Uh-huh.
go to your pediatrician and you have a well baby check and everything's great. And then all of a sudden
Right.
you're told you have to see a specialist. So
Right.
when we come in as parents, as moms, how do you help them get through, first of all, the initial shock? And secondly, how do you make them feel comfortable that they're here seeing you for something very serious?
For example, let's be specific. Let's talk about a case of a child who comes who's referred to me because of fever of unknown origin, like a fever that has been
Okay.
going on for like 2 weeks. And the
Yes.
child, the primary care physician is a little bit confused. He doesn't know what to tell them. So usually, I mean, most of the time, children with fever of unknown origin, the cause of it is viral. So eventually, the fever will subside, and the child will recover most of the time. In a small percentage of the cases, then we in a small percentage of the cases, it can be something else, like maybe tuberculosis of the lungs, or um, mononucleosis, or other conditions. So I tell them that we have to proceed with. I have to take a good history first, and then proceed with a good physical exam, and then. By the way, in children, 80% of the diagnosis is made just by by getting a good history from the parents. So
Mm-hmm.
a good parents who are good historian, they are very good at helping me make a diagnosis. And then I have to do a good physical exam, and I have to run some lab tests. And usually, like I said, with all the blood tests and all the culture and the swabs and everything, we finally get some answers in a small percentage of the cases. Most of the time, we don't find an answer, and the child's condition improve over time. So it's most likely a virus.
So, being on the subject of virus, and
Yeah.
if we can maybe switch gears a little bit and talk about the current pandemic,
Uh-huh.
can you tell us about a time when you first saw the pandemic manifest itself in the community? Can you tell me a little bit about your experience with COVID-19, if you've had seen it, or what your experience has been so far?
Well, I haven't. Okay. So when the when the epidemic started, when they decided to when the government asked people to stay at home, I was a little bit scared. I was getting a lot of family pressure not to go to work. But I said, no, I have to go to work, because why do I have to stay home, and other physicians in the emergency room have to see patients and put their lives at risk? So I never stopped going to the office, never stopped going to the office from day one. But in the month of March, I was still seeing kids with fever. Usually it's the flu season,
Mm-hmm.
but with the stories of COVID-19, I didn't know if it was COVID-19 or it was the flu. So I would treat them as if it was a flu infection, and always ask them to come back a couple of days later. And so most of them, they did okay. Some of them came back 2 days later with a fever. But I mean, in my practice, most of the kids, they did well. And if you look at if you read the literature and listen to the news, kids have not been affected that bad. I mean, they haven't been affected like adults have been affected from COVID-19, and for some reason they are well protected. And I think one reason could be that kids are having a lot of vaccine preventable diseases, and by getting those vaccines, they are mounting antibody response, and it's possible that those antibodies are protecting those kids against COVID-19. But we don't know yet. I mean, if this theory is true or not, I don't know.
So we want our listeners to understand what happens when a virus enters our body. What is it that is happening with our immune systems, and what exactly does our body go through when we encounter a virus?
Viruses enter the body through different routes. Sorry. For example, the HIV virus enters the body through body fluid exchange, like saliva, blood, blood transfusion. The COVID-19 virus, for example, enters the body is airborne. So we inhale the virus, and then it enters our system through our nostrils or our mouth. So the virus triggers a body response. So I mean, there are different cells among the white blood cells that respond. Like there are macrophage, macrophage T cells and B cells, which that try to fight the virus and control the virus. And so the way it presents, people develop fever, and depending on the virus, for example, the HIV virus doesn't cause cough. The COVID-19 does cause cough and fever. And if someone's immune system is quite good, he should be able to fight the virus, COVID-19. Like we've seen that 85% of the people who get infected, they recover. Mm-hmm. With HIV virus is different. They don't recover. They have an immune suppression, and they need to be treated. But there are a lot of respiratory viruses, like the flu influenza, a lot of viruses that where the patient body fights it, and then they recover. With regard to the COVID-19, so people at risk are the ones that that have risk factors, like high blood pressure or diabetes or heart or lung disease, or obese people have been at risk of having complicated COVID-19 infection. We don't know why obese people, but obese people are at risk for high blood pressure and diabetes. But even though they don't have high blood pressure and diabetes, they are still at risk. And so, yeah, I mean, it's a COVID-19 is still a virus. Still, we are still trying to understand how the virus works, and it's a puzzling situation because, for example, someone tests positive for the virus, he recovers, then he tests negative. Then a week or 2 weeks later, he may test positive. This has been a subject of controversy. The other thing is people who recover from infection, they get tested with antibodies. And now the NIH and the CDC are still hoping to get a antibody testing, a breakthrough, because so far the antibodies that are measured, they do not seem to be providing protection against the patient. Because viruses can mount different type of antibodies. Some antibodies only reflects that the patient has had an infection, but there are antibodies that are measured and they should tell us that the patient is protected. And with COVID-19, we don't have yet the antibody breakthrough that where the patient can be told that you are protected now.
Which is interesting because it seems like it's really puzzling
Yes.
the experts and
Yeah.
even to the point where presentation of COVID-19, because lately I heard that blood clots, that patients have
Yes.
presented with blood clots, and
Right.
and so they've actually died of pulmonary embolisms, and
That's
it
right.
ended up being COVID-19. So
Right.
so in your opinion, I know you're a member of the IDSA, of course.
Yeah.
So what are your society, what are they talking about, and how are we going to get to the crux of this virus? What are the next steps? What are we doing, or what are the next steps to help us?
So I mean, the next step, people are it's a race against time to find a vaccine. Mm-hmm. The vaccine will be the ultimate treatment. I mean, it will protect people from getting infected. Now, and of course, if they can find a cure, a radical cure to the virus, that would be also fantastic. Now, now the CDC has confirmed that there will be a second wave in the fall, and if you go back in time to 1918, the 1918 Spanish flu, the second wave was really more lethal than the first wave because apparently the virus has mutated between the two waves, and in the second wave has caused a lot of death. So the vaccine for COVID-19 is not going to be available before next year. Now, today I heard that they think that can have it ready by January of 2021. Maybe not, I'm not sure. So we are going to be facing the next wave, the second wave in the fall. And we have to be very careful because, when you look at the history of 1918 Spanish flu, it's not good because in 1918 they didn't know that the virus could come back again, and they lifted. So social distancing in 1918 was lifted after the first wave, and in the month of September of 1918, the virus came back in force, and so yeah, and the virus killed old people, young people, very well athletic people, and the very young, the very old, and very well built people. Because there is this cytokine storm where sometimes the body mount an immune response overwhelming that kills the patient rather than the virus, and it has happened
Right.
in the yeah.
Oh.
It
It's
has
like your
happened
own
during this.
body is fighting too.
Yeah.
Your own body
Yeah.
is fighting you as well as the virus is fighting you.
Exactly. So this is what happened with the
Interesting.
Spanish flu, and this is what's happening with the COVID-19 in some cases. So Yeah. So what's puzzling the doctors not here now with COVID-19 is those patients who suddenly their oxygen level goes down and they can't breathe, they're gasping for air, and then they have multi organ shutdown, and this kind of patient they don't do well, they die quite fast, and we don't understand why some patients they have this oxygen level that goes down that much. So it's a lot of uncertainties, and but you know we have to be hopeful that we have to be hopeful for a cure and a vaccine.
What do you think? What do you see as in the future?
Well, my theory, and I have two children. One is doing economics. He's going to finish this year. My daughter is going into college, and I told her do environmental science because with global warming, you will see more of those pandemics. Because when the temperature of Earth rises by a fraction of degree, this can change the behavior of viruses and bacteria. We don't know. We have our knowledge in medicine is like a drop in the ocean. But my deep feeling is that it's global warming that is affecting the behavior of viruses and bacteria. And I told my daughter this would be a fantastic field, environmental science. We need people to educate us about the impact of global warming on our lives. And I'm sure there are going to be more pandemic in the future. There is no question in my mind. No question.
It's a frightening thought, but it's a reality, and it's something
Yes,
that
yes.
we all need to be educated on. And this has been amazing to listen to your take and your expertise in here on all of this. If we can maybe just ask a little bit more about this current situation with COVID-19. Um,
Yes,
we and the social distancing aspect of it.
yes.
I've personally have encountered some stories where I have a family where the father, he is working in the prison system, so he
Mm-hmm,
is exposed on a daily
mm-hmm,
basis to
mm-hmm,
several inmates with COVID-19. The mother, she works in a doctor's office as well. They've got three
mm-hmm.
children. They live in a small apartment, 2 bedrooms. How do they protect them, the kids? I mean, they are using PPE, they use all of that,
Mm.
but you know, is there still a possibility that they can be carriers? And how on earth do they quarantine themselves in a small space?
So, so the father is the one that I'm concerned. So the father, I don't know if he gets tested every day when he goes to work, because this is important. He, you know, crowded situations favors the propagation of the virus. So I guess the father must be tested every day. And look, the most important thing is to have a good mask, wear glasses because sometimes the virus can enter through the conjunctiva of the eyes, and do a lot of hand washing. And if you do it in a rigorous way, I mean, you should be protected. So when the father comes home and the mom, they have to put their shoes at the front door. And the way I do it, we have a Lysol spray. So I Lysol myself on my clothes everywhere and my jacket. And I go and take a shower. And this is what I do. I mean, I guess the father should do the same thing, and the mom, you know. And but I think the father should be able to test himself maybe every day to see if he's infected.
Good. That's good advice. I know that they do take his temperature before going to work, but that is good advice.
yeah.
So we talked a lot about this virus and how different it is.
Just to interrupt you, the temperature
Sure.
taken, they use this gun on your forehead. Where I work at, every patient that enters the building, they check his temperature and they ask him if he's coughing or she's coughing. I had a patient who came to my office with 103 fever in my office, and she was found to be not febrile at the entrance of the hospital. So sometimes those devices are not very accurate. Anyways, that was a point I wanted to make.
Very.
Yeah, yeah,
But you know what? You actually we're on the right track, because I wanted to ask you personally,
yeah,
going back to your
yeah,
practice,
yeah.
can you tell us, or can you describe how your practice has changed with respect to the pandemic? What was it like before, and what's it like today?
Look, what has changed is wearing of the mask, putting my glasses, and washing my hands after each patient, and sometimes more frequently. Like at lunchtime, I wash my hands 2 times. After lunch, 2 times. After each patient, I wash my hands a lot. I try not to touch my face with my hands. When I do it, I panic. I go and wash my face a lot. And my nurses are doing the same thing.
Yeah.
So that's all we are doing. I mean, there is nothing else you can do. And of course, we have a Lysol sprays, and we spray the whole office every day, at the end of the day or the beginning of the day, and we hope that we won't be infected.
Well, I think a lot of these changes have been, in a sense, good, because
Yeah,
we should all practice proper hygiene. We should all wash our hands. I know that right now we're doing it even more, but
yeah,
in the grand scheme of things, we all need to be more vigilant, and we all need to be more cautious.
that's right.
So
Of course.
thank you so much for all of this amazing information. It's been wonderful. Can you tell us, there's so much out there. What is
Yeah.
the best place? What is the best resource if we want to know and be updated on COVID-19?
So you can go to cdc.gov, and you get a lot of information about COVID-19.
So, Dr. Watchi, everything that you have shared with us today has been amazing, and we've learned so much. But in closing, what message do you have for the children that are exposed to all of this news, and they're listening to parents, they're home from school, their lives have completely changed. So what message do you have for them in particular with respect to what's going on today?
Okay, this is a good question, actually. So when I see adolescents, most of the adolescents are scared. And I've seen more adolescent girls than boys scared and having anxiety. I tell them that, listen, it's normal to be afraid, but remember that COVID-19 is harmless. It is harmless on people under 25. And I strongly recommend them to do exercise. 1 hour of exercise is good to cope better with the situation, like jogging, running, biking. I do every day 1 hour of sports every day myself. Now, for the little kids, they don't. I mean, most of them are not concerned. They don't understand what's going on. But I remember I had a African American family, and the kid was like 6, 7 years of age, 6 years. And I told him, are you worried about COVID-19? He said, yes. I said, why? He said, because a lot are dying. And I mean, the news are showing that African American have been affected more than other people. And so I told him, you don't have to be worried because you are a little kid, and COVID-19 doesn't harm little kids. And he didn't say anything. He listened to me and he said, okay. And, but, you know, I mean, eventually this epidemic is going to affect this young generation for years to come.
Agreed. Those are some powerful words. And I think sometimes maybe as parents, we need to be careful what we expose our kids to in terms of
Yes,
the news and the media and things like that. And as parents, it's our jobs to also make sure that they feel protected,
that's
right?
right. That's right.
So
That's right.
thank you. That's a great message. I really appreciate your time
Sure.
and it's been wonderful. It's been wonderful. You're a wealth of knowledge, and
Thank you.
I think that our listeners are going to learn a lot from today's show.
Thank you. Thank you. And we hope that a vaccine will be found very soon. You know, we really need that. We really need to be the epidemic to be behind us.
Absolutely.
Yeah.
Yes. It's tough,
Yeah.
but we all
Yeah.
need to realize we're in it together, as they say. We're in it together, and
That's right. Yeah.
we need more information like this to be
Yes.
out there so that people can really comprehend the seriousness, especially since we're going to be seeing that wave. So once again,
And
it's very important.
and we have to have faith in
Yes.
American medical progress. I have strong
Yes.
faith in it.
Yes, we all do. We're all there. Thank you so much, Dr. Watchi.
Yeah.
Please
You're
stay
welcome. Thank you
safe and healthy. And thank you
Thank
for
you.
being on the front line, for caring for our children. That's
Sure.
what you do is so important. Thank you so much.
Thank you. Thank you very much. Thank you for inviting me. Thanks.
Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Health Journeys is produced by Victoria Bilionis and executive producers Dennis Lovelace and Greg Hasty. Finally, if you're enjoying the show, please subscribe, tell a friend, and visit us at hastystorytelling.com.